One of the really interesting things was that, throughout the online programs, the young people or the parents, they were really pretty happy with the modality. They felt comfortable. They, felt that there was good group dynamics. They felt they connected with the therapist who was delivering the online session. But the interesting thing was when we tracked the therapists, they were a little bit more hesitant to start with. And so they took a little bit longer over time to warm up to the new modality.
Ursula Sansom-Davey, welcome to PECSIP's Leading in the Changed World series.
Thanks for having me.
So today we're going to talk about telehealth and in particular the humans inside of telehealth. But the reason we've asked you here today because you've got a bit of expertise in this area. You've got a PhD and Masters in Clinical Psychology. You're a Senior Research Fellow with the Behavioural Science Unit at the School of Women's and Children's Health at the University of New South Wales. And you've had some prestigious early career fellowships from both the National Health and Medical Research Council and the Cancer Institute of New South Wales, and been the chief investigator on some pretty significant grants, up to $10 million worth, I think.
Something around that, yeah.
Yeah, and you've got lots of other awards which we won't cover today, but sounds like you've been busy.
Yeah, I have been busy, and like you said, I am very lucky that I get to wear two hats in my job. So as you've described, half of my job is doing the research side of things, and then half of my job is actually working clinically, in my case with adolescents and young adults with cancer, which I really enjoy. It's really rewarding work.
And so why is that so exciting for you in terms of working with youth who have cancer?
Yeah, it's an interesting question because I would say whenever I meet someone new, dinner party situation or, just a meeting, often you tell people that you do that work and the first response is, oh gosh, that must be so hard, that must be so depressing. And of course it's sad that anyone gets cancer, and particularly when a young person is diagnosed with cancer, of course. But I think from a psychological perspective, I really enjoy working with young people. They're very honest and frank, and even throughout cancer treatment can oftentimes have a really excellent sense of humour. So they keep it quite real and make sure that you stay quite grounded as well. So I really like that. And again, from that mental health perspective, if you can help a young person, whether that's a child or an adolescent or even a young adult, learn some new coping strategies, some new tricks and tools and ways to navigate through the world, they might learn it relevant to their cancer experience at that time. But if they can learn some useful things at that point, that can actually set them up for the rest of their lives. And that's so important because we know actually most young people these days, fortunately, will survive their cancer. And so it's actually really critical for us to be thinking about what next and how do we help them, get into their future lives afterwards.
Must be incredibly rewarding.
Yeah, I love it. And, it's tricky at times too, of course. There's those elements of cancer that are sad and difficult and all of those things that we help our patients and families with. But that the interpersonal element of it is really what I love, working with people.
So today we're going to talk about telehealth, and telehealth has been around a long time. The first implementation that I recall working or involved in was back in 1994. And with what's been happening in the world, many people now have been involved in a telehealth consult with a clinician or a doctor. And today I really want to delve into your experience and your clinical experience in telehealth, and in particular the impact that it has on patients and clinicians. So for those that don't know, the word tele in telehealth means distance or afar off. And so really what we're talking about is we're talking about delivering healthcare from afar, aren't we?
Absolutely. And I think, as you'd know, these days in the health setting, most often that's sort of actually talking about what we could also call a video conference. So like we're doing now, over, through your computer. But I think sometimes people also do use it to refer to, old-fashioned kind of telephone type consultations as well.
Yeah, so it's been around for a long, long time. I'm really interested in, I'm just going to quote something from a paper that you've written that says, we argue that a key lesser acknowledged barrier is the contention that telehealth is not capable of transmitting the humanness required to support effective interactions within psychological clinical care. Can you explain that in a little bit more detail?
Sure. So I think that, I've been working with telehealth like you, not as long as you, but for a number of years as well, certainly pre-COVID and pre-global pandemic days. And one of the things that is first or immediately obvious with telehealth is that there's technical stuff to get the hang of. And that's the sort of low-hanging fruit in terms of the barriers that can get in people's way of using it. And certainly...
So just because it's new and they haven't experienced it before, is that what you're talking about?
Yeah, so people can be nervous. How do I actually do it? What's the platform I'm using? How do I navigate it? How do I explain to my patients or my clients how they do it? What happens? If the call drops out, what do we do then? All of those kinds of tech-related worries. And if you've ever been in that situation, it can be, can make you a bit perturbed or flustered when that stuff does happen. But, myself and colleagues really noticed as well that there was this second thing going on that I think people didn't as often put into words or couldn't put their finger on. But it was this sort of general hesitance to use telehealth for, I suppose, inherently interpersonal interactions, and we saw that in work that we were doing. We developed online psychological interventions for adolescent young adult cancer survivors as well as parents using a group-based sort of group therapy format. And through those programs and those research trials, one of the really interesting things was that, throughout the online programs, the young people or the parents, they were really pretty happy with the modality. They felt comfortable. They, felt that there was good group dynamics. They felt they connected with the therapist who was delivering the online session. But the interesting thing was when we tracked the therapists, they were a little bit more hesitant to start with, and so they took a little bit longer over time to warm up to the new modality.
Was that a surprise to have patients more comfortable than the clinicians?
A little bit, yeah, a little bit. I think less of a surprise for the young people, because I think young people always get branded with that sort of digital native kind of stereotype of, they'll just take to it like a duck duck to water. But it was a surprise to see how flexible they were around, even when the technology didn't work, because let's face it, we don't always have the best internet in every location, in every hospital in Australia. And we were doing that to people who sometimes lived in really remote locations as well. But I think that hesitance, the clinician hesitance around telehealth, that, it's just not quite the same. Can you connect the same way? Can we still, is it sort of psychologically safe even? There's some worries about that. And I think that when COVID's, sort of happened this year and there was this sudden uptick in how much telehealth was happening, I was able to observe that wave of sort of almost anxiety through my clinical colleagues of, all different disciplines. And obviously there was a rush to kind of get the technology and make sure that was all up and running. But there was also this rush of, quick, we need to feel better about doing this, and we need to get more comfortable with it all.
Yeah, right. And so in terms of the things that the clinicians found harder or perhaps less comfortable doing, were there some key themes that were running through that?
Yeah. One thing I think that does get talked about a lot is the fact that, in a sense, you are getting, you're getting less information. You're getting sort of a box of, an image of a person, and often it's only sort of from, the torso up or even the shoulders up. So, for someone...
like we are on this video call,
yeah,
you can only see from sort of my chest up and likewise. Whereas if we were face to face, you'd get, the whole arms thing, you'd get my legs crossed or other things that might be happening.
Yeah, right. That's right. And different health professionals might find that, tricky to a greater or lesser degree. I think certainly people sort of more in the mental health or psychosocial fields might find that means they lose information. For example, I might miss seeing if one of my patients is nervously, playing with their hands, or, they've got their foot's tapping under the table, or, you might miss some of that kind of full body language. So that gets talked about a bit. And then I think the other thing that I think people do find challenging, but this is the bit that I don't think people talk about as much, is I suppose how it changes the dynamic of the consultation. Because I think that when there's this sort of almost third factor, the technology and the sort of web medium that you're going through, that introduces a level of unpredictability. And I think that for many clinicians and health professionals, that can feel a bit uncomfortable, this idea of not being completely in control of the interaction. I think that can challenge that sort of need to appear professional and polished and all of that.
It's interesting because a lot of the telehealth that was conducted pre-COVID, a lot of it was done in very controlled telehealth environments. And I've been involved in some of those big implementations where the clinician's in one location, the patient's likely have gone into a hospital in a remote location where you've got high quality cameras. I can zoom in or zoom out, at the other end to see more of the patient. Whereas today, if we're doing that with a phone, and the patient's at home, we've got no control, or a lot less control in terms of what we see and what they see of us.
Absolutely. And I think the thing that I found interesting, reflecting on telehealth, as it was just this sudden expansion through COVID, is that, it's a trade-off of lots of different things. So it's kind of like comparing apples and oranges in terms of, face-to-face versus telehealth interactions. And so there is lots of information. I can't see your legs, I can't see your full body and what it's doing. But on the other hand, from my perspective, I've very often had sessions with some of my teenage patients who, as you say, are, just dialing in on their smartphones, plonked up on their beds. I can see all the posters of bands and their artwork behind them on their walls, and their face is filling much more of the screen. In a consultation, I wouldn't be that close up to their face. And so that, in a sense...
And you wouldn't get all that other contextual information either about what's going on inside of their bedroom. And do they feel more comfortable because they're in their bedroom having that conversation with you rather than being in an actual consulting room?
I think they can, and I think it can go both ways. And so I think when it comes to using telehealth in a really person-centred way, I think that's one of the factors that's really worth paying attention to. And that's going to depend on the patient or the client, and it's also going to depend on the context or the purpose for the consultation. So absolutely, I've had some patients or clients who definitely felt more comfortable in their sort of home environment, in their bedrooms. As you say, you get that extra information, so it's actually quite a nice way to connect. You can actually say, oh, tell me about the art on your wall, or they can kind of, talk a little bit about that. On the other hand, you do have patients or individuals for whom the home environment might not be their safe and comfortable place. So, for example, young people, with really tricky family situations and home situations, home doesn't necessarily feel safe and confidential in those cases. And so it's a matter of kind of, making sure that you explore that with them, before the appointment, and kind of looking at how that's going to work.
I imagine the conversation between a clinician and a patient sometimes is a difficult conversation, particularly when bad news is delivered. Does the location of where that news is delivered impact the patient? So, as an example, if I'm delivered bad news in the consulting room versus delivered that bad news inside of my bedroom, is there a difference in terms of impact?
I think there could be, and I suspect that, my medical colleagues, for instance, are already taking this into account in terms of how they're managing which consultations to have over telehealth versus in person. I think certainly there's kind of a safety or almost a kind of a duty of care thing there, in terms of if you're giving someone, bad news or potentially talking about something distressing, you want to make sure that they're going to be safe from an emotional perspective afterwards. And of course, in the hospital setting, how that might happen, say in the Children's Cancer Centre, if there's a really distressing conversation that happens, the doctor, even if they have to leave, they can bring in, someone from Allied Health, maybe a social worker or someone to kind of sit there with the family. When you are simply dialing out of a consultation and leaving a family or a patient in their own home, that's a slightly different thing. So I think there's a safety consideration that needs to be considered and maybe planned for in advance. In my line of work, I'm not typically sort of giving bad news, so to speak. But some of the stuff that people could be talking about with me could still be distressing. And it is worth thinking about, what you're going to be talking about in consultations or in your meetings, and whether that's going to be appropriate for that setting. We know from, basic psychological research about how people learn and how memories are created, that when we're learning things or, taking in new memories, particularly emotionally laden or emotionally charged memories, we're not just sort of taking in that memory, but our brains are kind of encoding or mapping in lots of information about the environment where we learned that thing. And so if you get a piece of bad news sitting in a very particular looking doctor's office or a very particular ward with a very particular antiseptic smell, chances are those cues, those environmental cues will kind of trigger that memory and kind of bring it up as a reminder. So we need to think about that. If we're talking about things that are distressing in the context of our own homes, what's that going to be like for that person when it's their bedroom or their lounge room or their kitchen? Is that going to be something that we need to consider in terms of them living with that also being a reminder of this kind of clinical consultation? I think it can potentially work for the better though. For example, I was thinking about maybe cancer survivors, if we needed to do some kind of dietary intervention, talk to them about healthy eating after cancer, and they're sitting in their kitchen, maybe that's a great way and a great place for them to be learning that information. So I think there's no right or wrong about it. I think it's just about considering, where are they going to be? Is that the right place to be discussing this content? And how is that going to place them after the consultation's over?
So if I'm a clinician listening to this, what do I need to do to provide the best experience or the best outcome for one of my patients if we're conducting a telehealth consult?
Yeah. I'm going to leave all the tech stuff aside because I think there's lots of information you can get on that. But I recommend that people view telehealth as really just a tool or a modality that you're going to use. And ultimately, you need to remember that you're still two people trying to connect and have a conversation or an interaction. And so a lot of the behaviours or things that you can be doing to help put a patient at ease, help them feel comfortable, help orient them to the session are still similar types of behaviours that I would hope people are doing in practice. So,
in person, if they're normally in person together, the same types of behaviours, yeah, absolutely.
Absolutely. And so things like taking care to introduce yourself, if it is the case that you're meeting someone for the first time over telehealth, that can be tricky. And so taking care to introduce yourself, one of the things that can be tricky with the video conferencing is that often our cameras are not where we want to look, which is where the faces are on our screens. But taking care to sometimes at least consciously give eye contact to the patients, give a smile, give warm facial expressions, because it's, if if our face is filling up most of the screen, that stuff matters even more. And really, I think that it can be the most comforting or kind of disarming for patients if we're just quite honest and open about the process and say, just introduce yourself and say, have you had a telehealth session before? Have you connected with other people and professionals like this? What was that like? What worked well? What didn't work well? Actually just naming it and exploring their preferences and experiences. And that kind of conversation around sort of almost ways of working and what works better for them, I think is a conversation that we could probably do more of in our face-to-face interactions as well. I think we can forget to do that in the busy, clinical or hospital environments. The patient comes in and we just assume that our clinics work the way they work and they're just going to deal with it and whatever. And I think actually if we're thinking about patient-centered care, we could probably do with a bit more of checking in and, how is this going for you at the end of the session? Was there anything about that was tricky or that you found difficult, or, how could we do things differently next time?
So from a patient perspective, if I'm coming to a telehealth consult, what should I be thinking about to get the best out of my conversation with my clinician?
I think really, I always encourage patients or clients to be asking questions, and that can even include if your clinician, if your health professional doesn't give you a sense about how the consultation is going to work at the start. Hopefully they will, but if they don't, feel free to ask and say, okay, so how's this going to work today? what happens if one of us drops out? I think it's always good to make sure, you know, at the very least you have each other's phone numbers if you need that kind of plan to reconnect or things like that. You know, have your questions ready. And also, I think for the patient, it's really important that you are somewhere that you feel comfortable and feel that you're not going to be disturbed, and it feels kind of a safe and confidential space. And hopefully that's something that, you know, your health professional would also walk you through prior to the appointment, you know, figuring out where's the right space to meet. And, you know, if it's the first time that you're meeting your health professional, if it makes you feel more comfortable, you've never met them before, you could ask them to tell you a bit about where they are. You know, I've, you know, heard that sometimes people want to see what the doctor's office looks like if you've never been there. Okay. So, you know, things like that. I guess the bottom line of all those things is not to feel afraid to ask health professionals, you know, a doctor or a psychologist, don't be afraid to ask them about how the consult's going to work and any questions that you have. I think sometimes it can feel a bit scary, you know, there can be that kind of power imbalance. But frankly, I think a lot of health professionals, we can get a bit caught up in our agenda of what we've got to, you know, communicate or what we've got to achieve with a patient in a particular session. And then probably there's a little bit more noise going on because we're also keeping track of the video conferencing technical, you know, the technical aspects of that. So if a health professional hasn't taken you through that, yeah, just ask questions.
Now, obviously your work is centred a lot around youth, who we all consider digital natives and should have this stuff nailed. I assume that's not the case. But has your research or your investigation turned up a lot of difference between sort of the young, middle-aged, the older demographic in terms of their engagement inside of a telehealth consultation?
Yeah, so I will preface this by saying that I haven't done a lot of research with older adults, but from talking with colleagues and from my own experiences with young people, I think it's safe to say that we just need to, you know, be open-minded and not stereotype too much with how people might take to telehealth and those kinds of things. I know colleagues who are using telehealth with older populations have found that many of them quite like it, and for them it's quite convenient as well. And similarly in my population, you know, with young people, yeah, we call them digital natives and we complain about how much time they spend on their phones, but I was quite surprised during COVID how many of them had quite strong opinions that really they'd prefer face-to-face if it was up to them. And so I had the full spectrum, and then I had people who really liked the telehealth and have kept using it even after they were still able to come in face-to-face. So I think you can't assume, that would be my bottom line. Every person's different. One 18-year-old is different to the next 18-year-old.
So for those that are watching today, before we wrap up, maybe is there 3 top takeaways that you could give either clinicians or patients in terms of how to get the best out of their telehealth consultation?
Yeah, sure. I think my top tips are really more for the health professionals for a couple of reasons. That's sort of the side of things that I know best. But I also think that as health professionals, it's our job really to lead the way and to help make it a safe and a comfortable place for patients. They expect that of us. And so I think really, if we're doing our jobs well, we should be kind of stepping them through the process. So my first tip is really, it's still about two humans connecting, and this tech stuff is just the modality that's in between us. And so the first tip is really just to be curious and stay curious. And that, you know, by that I mean, you know, don't assume, like I was saying, don't assume that one person is going to automatically love telehealth just because they're, you know, 22. And likewise, don't assume that they feel the same about it at every point in time or for every consultation. You know, I know with my patients from one session to the next, very different stuff can come up. And they might be more distressed or less distressed or have different things to talk about. So I think it's coming back to checking in about those ways of working. You know, what's going well for you? What is working well about this process? What are you finding tricky, or what could we do differently to make this more comfortable for you? The second tip that I had was really to be patient. And sometimes, you know, viewers who've done telehealth consults will know that the technology isn't always perfect. So there's that element of it, you know, being patient when it does drop out or whatnot. But more so being patient with the fact that even when your Wi-Fi, your internet is brilliant, even when the picture is smooth, Consultations still can unfold in a slightly slower pace online than they do in person. There's probably a number of reasons for that, but one of which is I think that we cue each other slightly differently in the online space compared to face-to-face. So as a health professional, the kind of process of guiding the session and kind of stepping a patient through a number of things, that can just take a little bit more time. So we gain efficiencies on the one hand because, we maybe haven't had to travel, the patient hasn't had to travel, we can see one patient, then see the next patient, bang, bang, straight after. So there are efficiencies to be gained, but the process can be a little bit slower as well. And the third one that I've thought about is really this idea of being open. And I mean that in two ways. I think we can be open about who's going to really like telehealth and really embrace it, and who may not, who may feel a bit more uneasy. And it's not necessarily always going to be the young people versus the old people. So being open as to who it's going to work for and when. But I also think that it's really important for us to be open in how we conduct our consultations. We hold a lot of knowledge in our heads as health professionals, and we kind of know what we're doing and what we're planning for the session. And our patients and clients don't always necessarily know what we have in our heads as our agenda for the session. So I think it can be really helpful in putting the patient at ease to actually narrate what we're doing a little bit more. And so that can be simple things like, if you have a patient record up on the screen or something like that you need to be able to look at the same time as having a consult, it's okay to break eye contact. And in fact, if we were having a face-to-face session or a face-to-face conversation, it would be kind of unusual for us to be staring at each other in each other's eyes 100% of the time. That doesn't sort of feel normal. It's okay to break eye contact, and if you're doing it for specific reasons, to jot down some notes, just narrate what you're doing. I just need to take some notes in your record now, or for me, I might be jotting down some of their psychosocial history, and I might just say, I'm still listening. It's really important that I just get some of these bits of detail down so that I can remember all of the key parts of what you're telling me.
Because if we were in person, I'd be able to see that you're looking into your screen and typing. But if I'm seeing it remotely, I may expect that you're checking your emails.
That's it. They might just think, oh, okay, I've lost their interest, I've lost their attention. So I think it can be really helpful to just narrate that. And, and the same way that we can do in-person sessions. So doctors might only often have quite brief consults, maybe even 15 minutes. Psychologists like me, we might tend to have longer sessions, 45 minutes, an hour. And so it can still be helpful to kind of at the start of the session say, this is what I'm thinking the plan for our session today might be. And I thought we might spend a bit of time hearing about your week this week. And then I really want to check in on how your anxiety's been. And then we might spend some time talking about those coping strategies that we kind of looked at last week and see what's working and what's not working. How does that sound as a plan for today? And is there anything else that you want to bring up? What questions do you have?
Fantastic advice. And hey, look, I've really enjoyed our conversation today. I think there's a lot of gold in there for both clinicians as well as us as patients who are being involved in telehealth consults these days. Thank you so much for spending some time with us today, Ursula.
Thanks so much. It was a pleasure.
Really appreciate it. Cheers.